So, and I would like to invite Dr. Nhung to share his experience. He's actually involved in the process of decision making for this kind of strategy. Please, Dr. Nhung, can you share the screen?
Thank you very much, Dr. Quy, for the kind introduction. Uh, hello to everyone. I would like to share with you with the title, with the in Vietnam. It focuses on the responding from the hospital, but also give you the picture of the whole picture in Vietnam. My talk will go to the first COVID-19 the war and Vietnam, and we respond effectively. Of course, we are one of the most. It's not the only one. High gap risk to the lung hospital and impact to TB control in Vietnam, and safe hospital is the key for the safe, sustainable development. And safe hospital model proposed by our hospital is the National Lung Hospital. This picture shows you dramatically increased mortality. Within about 4 months from the beginning with the top 20 mortality disease in the world. And after the 4 months, it go to the 3. And now it's exceeding this number. This the July 2020, but now it's November, is 1,000,000 is 400. So it's already on top. This picture from the WHO. Up to the 24 November to 2020, it's already nearly 60 million people is a confirmed case, and nearly 1,400,000 case deaths report to WHO. That is reported to WHO. But with the other data might be bigger, but that is reported to WHO. We can see in the world, the majority in America, second Europe, in Southeast Asia, and very fortunate, so we are in the Western Pacific, is the lowest in the prevalent and incident. This is a picture in Vietnam. We can say we have been successful in all 3 outbreaks. The first outbreak in the Vĩnh Phúc, almost imported case. And we can see here in the map, only 19 cases. The second in the Hanoi capital, is the firstly imported case, and then community transmission cases in the local, and reaching the 165 cases in the second outbreak. A little bit different with in Japan, that the outbreaks even later is more severe as compared to the last one. The third outbreaks in Da Nang, much more difficult because the spread of the disease in request of the government is to fight the epidemic and also maintain social economic development. That is a nation for the health sector. That is very difficult. The first and the second, we concentrate more for the control the disease, but the third is the guidance of the government that we need to have a dual objective. So the question is how to develop safety. That is important. So here, that is the picture to show us the situation in Vietnam. Number one, we can see here, the most transmission is the household contact. This is important. And this shows us the close contact is important. And majority, the second, the third outbreaks did come from the hospital. We can see the Da Nang hospital here. And the second is close contact. We know how to COVID-19, how COVID-19 risks to the from the K to the other. That is very important. And here we can see the impact to the TB detection. As we know that the COVID-19 and the non-COVID-19 disease have impact, very severe impact. And we also analyze impact to the tuberculosis detection. We see that we compared to 18, to 19, and to 20, we see the dramatically reduced in the two months, the March and the April. We can see is reduction in the 12, reduction to 32, and 27, and later recover. That is for the TB detection. And we also analyze in the zonal. Zonal is the deeper reduction in the north, because the disease comes from the north. And the second is in central and south later. We also have an impact to the south as well. And the impact to the economy, according to IDB, we see GDP growth rates. We see here's analyzed. In the 2020, it still have a positive 4.1 point increase. Inflation is quite the same, and employment is quite the same. And here we compare to other countries. For example, it's Myanmar and Laos and Vietnam. We are here in the middle. In the inflation, it's the middle, and the capita GDP is also other. But the data is showing that 3.7%, and compared to other countries, some minus. That is the impact to the economy. So why we achieve this? We try to share with you experience in the nature. The response one is the most important. We call here the whole political system. The first rapid, strong, and multisectoral response, and we learn from the other outbreaks, other pandemic, from 2003, SARS, and H1N1, 2009. So from beginning, the 3rd of January, and later with the February, we can see a lot of the intervention here. It's the first COVID-19 case detected, and now it's a hotline set up, and we contact tracing, mandatory quarantine, and school closure across locally. And then one village in lockdown, for example, we very strong at the beginning. And later on March, we can see that mandatory quarantine to the country, national TV broadcast for the communication. And then later we go further. And when it's expansion, we have a social distancing. That is open, this close, and school open. That is the first outbreak. I think it's very successful for the rapid, strong, and the multisectoral response. And response 2, we call the TTQ, test, trace, quarantine, rapidly based on the epidemiological risk of infection. We test target high-risk group, including the people traveling from the overseas, close contact, and the people with the suspect disease, people living with community with the outbreaks, and regardless of symptom. We know that the more 50% the people with infected but no symptom. So testing capacity increase quickly. We apply also pooling. Here we have a picture for the testing we apply. And if compared to other country, for the 1K detected, we need to test more than 1,100, and highest in the compared to the world. That is one thing is emphasized. The second trace, the first hand and second hand contact is confirmed case rigorously and rapidly using technology. The police officer and with a registered citizen, social media, social network, neighbor. See the metric here. And with the mapping, we call the F1, F0, F1, F2, F3, F4, F5. based on the level of the close contact, house close contact. We can see here, and so rapidly we can detect all of the case affected by the zero. If the case detected, even the F1 to turn to the F0, and then the same with the other level, that is trace. The third quarantine is the 14 days for the people with history exposure to confirm or suspect case, regardless of test result. Even test negative, we also the quarantine according to the rule, and these are compulsory. We can see the quarantine center here, and also the quarantine in the hospital. And the hospital also we use for the quarantine with the F1, and the center might be shared with this quarantine policy. And F2 is quarantine but at home. And other response targets lockdown, of course, based on the level of the infection. Totally, it's lockdown at the moment might be 10 million. And when the lockdown is daily check the symptom test for the SARS-CoV-2 by the Realtime PCR, mass serology testing, basic food, healthcare, and necessary goods were provided. That is the principle for the lockdown area. And the number 4 is also very important. We gaining trust of all the people, the population, by the transparent the information, and also the buyers. Also, we need to manage information in the good way. And the fifth is social distancing, traveling restriction, and the border closure in the state. That all of this is makes our success in this COVID-19 control. So now it's a new normal. How to be safe, and hospital we identify will be the target of the COVID-19 attack. We understand that the lesson from the Bạch Mai Hospital, Da Nang Hospital, and E Hospital shows the case that it's a very dangerous scenario when the hospital is not safe. All hospital, and especially in respiratory hospital, will be the target of the epidemic attack, because the people got disease will have symptom or not symptom, but with the symptom they come to hospital for the examination. We cannot know at the beginning is COVID or non-COVID. So with the experience of infection disease, and let's learn from the 3 outbreaks, and based on the guideline of Ministry of Health, our hospital, National Lung Hospital, and proposed a model for the safe hospital with the 3-layer screening plus expert express SARS-CoV-2 testing, and also for early tuberculosis detection as well. We can share with you some similarity of the TB and COVID-19. That is the concept we propose. These are both disease is the same infectious disease. Epidemiology we see at the beginning a little bit different, but now is very different in the opposite side. At the beginning, the incident is 10 million TB is very high, but now incident of the COVID-19 is 60 million. The death for the TB is 1.5 million, but at the moment the COVID-19 also reaching 1.4 million. That is really disaster. And in Vietnam, we have a TB with 170,000 incident and 11,000 with mortality. And now it's COVID-19. We see the 1,316 and accumulated deaths for the COVID-19 in Vietnam with the 35. The data based on the 25 November 2020. Transmission modes of both disease is quite the same, but the tuberculosis is even more severe, more dangerous because of airborne transmission. But the COVID-19, we understand that the droplet and the exposure to infection sources, that means close contact. The organ to be impacts, that's the own organ, but majority is lung pulmonary tuberculosis at 80%, and COVID-19 we very severe in pneumonia and plus very many organ. In fact, we understand that the heart, the vascular, and other the neuron and other organ as well. The symptom, the difference between the two diseases is chronic and acute. That is the most important. But cough, sputum, mild fever, waist knot, that is for the TB, and the fever is the higher fever, dry cough, sore throat, and diphtheria for the COVID-19. But the acute is very important. Diagnostic, we based on the X-ray lab test, like AB, culture, DST, and the same, the two tests you can use as common, that gene expert or TUNAT, the gene expert for the 19 based on the standard, that the real-time PCR. The treatment, we have a standard regimen for the own facility, even the community-based treatment, but the COVID-19 we do not have specific treatment, but isolation and non-specific care. Prevention, the vaccine, but only preventing severe disease for children, but the vaccine at the moment as a beginning, but we do not see the impact of the vaccine to the control of the disease. To control, we need to end the TB by early detection and cure all patients. And the COVID-19 need to do the same, the early detection and isolation. We can make this disappear. In Vietnam, we're now reaching nearly the 3 months already don't have transmission in the community. So to answer the question, how to make the hospital safe and safe hospital model for the COVID-19 response, that is suggested by Ministry of Health. So our hospital propose this model. The model with the 10 bullets, that class 1 screening, class 2, class 3, test capacity building, emergency response unit, control of the hospital infection, logistic for epidemic prevention, by family visit with patient boarding, and information technology application and operate and connect to the handle risk that arise. This scheme to overall of this model. That is the nature of the model. I can explain to you in English one by one. So national tuberculosis control, we call the optimal use rapid test expert express SARS-CoV-2 for safe hospital. At the beginning is the own visitor. We call the screening one. That is a layer 1. So we check all the COVID-19 suspect. If the answer yes, so we provide isolated clinics. And in that, we will test expert rapidly, about less than 1 hour. If the positive, we transfer to the isolated department. But at the moment, we design another hospital. We can transfer to the other hospital to assignment for the COVID-19 treatment. And if the negative, we also put in the isolated department, because we already identify the COVID-19 suspect. So need to handle it this specific department. And if no, and the patient goes to clinic, we are called the layer 2. We call the screening 2. And screening 2, we also make this again, let's say the double check with the other tool. And if the answer yes, we also test expert. And if the positive, we transfer to the specific hospital, or if the later is bigger epidemic, we can handle in our hospital. That is makes this more complicated. And if it's negative, also we put in the isolated department here. And if the no, we can put them to become the outpatient, but the consultation with COVID-19, how to prevent the COVID-19 as well. And if they need to hospitalize, the patient admit to the ward. And we call here is layer 3. Layer 3 is that we provide a pre-ward room to like a reception. And the patient need to be examined very early and very totally to check and check COVID-19 as well. Is COVID-19 suspect? Might be some COVID-19 identified here. So if yes, we also transfer to the test expert number 3 and also do the same for the result of the test. But this less risk, we call this is green, and this is the middle, and it's here the red. And later we put in the regular patient room, but visually with COVID-19 during the whole patient stay. That's on the scheme of our model. And we have another the 24-hour clinic. That means to receive emergency case, and we do the 2 criteria, layer 1 and layer 2 as well in the 24-hour clinic. So here you can see the layer 1. Layer 1 screening, we challenge on the visitor and screenning at the hospital, based mainly epidemiology, sign of the cough and fever, sore throat, difficulty breathing. So you can see here is the challenging. If they got the fever, they go separate way, and not they can go in with the camera temperature check with the camera here. The people distant from the other is at least 1.5 meter. So here is a scheme very clearly how to do, and that is isolated clinic. The people here and ventilation from here, and the doctor here, the patient here, and the patient bed. We also provide the check X-ray for the X-ray car very near to the screening area, and this is very safe for the specimen taking. This is label 1. The layer 2 screening, we put more deeper to ask the patient with some clinical sign. For example, the chest X-ray, might be the CT scan. We see here is no symptom: fever and cough, sore throat, headache, and myalgia, fever, cough, and so on. That is we double check. It's more strictly for the COVID-19. Here we can see the role of the chest X-ray and the CT scan can make it. We emphasize if the lesion, like the ground glass lesion, and both the sign, that is the signal to indicate the COVID-19 at the moment. And layer 3 screening is the inpatient ward. There are buffer room, we call the pre-ward room, to welcome and double check the risk of the new patient to the ward and monitor visually with the COVID-19 during the whole the stay. Here we also provide the specimen taking, and here is like in the 24 hours clinic, they do both class 1 and class 2 for screening. Isolated department is important. To handle screening result of the own grade requires isolated treatment unit, and we call emergency response unit. And this must be separate from the rest part of the hospital, with the red, the yellow, and the green zone for the patient who needs to isolate after screening of the own labor. And the most important control is early detection that requires a test sensitive and fast enough to minimize the risk of transmission, such as export express, SARS-CoV-2. That is very important. We introduce you now. So this is a scheme of the emergency, or let's say isolated department, with the green, yellow, and the red one based on the level of the risk of the infection. Monitoring patient as well with the distance, the bed, patient bed distance is 2 meters. So here is like a standard of us. And here's isolated. We call here's emergency response unit that limited with travel. So the Ginsburg Express SARS-CoV-2 is the test we mentioned to you, already approved by the FDA and recommend WHO, and it's already filed for this confirmed to use with sensitivity and specificity already identified. This is a picture for the Express SARS-CoV-2 kit expert with the number, the kit, the pipette, the store condition here is 228 degree. We can see here, we see that this test targets the 2 gene E and N2, internal control in each direction, very close system avoiding contamination, symptom procedure, the point of care, very fast and high sensitivity and specificity. We can do also the pool can be effective. We can see here that is some technique. And Vietnam, we have already 216 machine, and Ginsburg side with the 147 side. And here we can see the picture with the positive, and here's the result negative. That is very simple in the implementation, but of course inside the technique is very complicated. As a point important, first, minimize risk of the cross transmission in hospital. That is very important in the hospital. The second, to activate infection control, good ventilation, adequate bed distance and PPE, and good clinical practice at all corners of the hospital. Limiting patient and family to visit hospital, controlling own visitor, and providing safe nutrition within the hospital, and strong standby steering committee to promptly address the risk condition are very important. We can see here is the PPE. We are PPE, but use it adequately, use it correctly is very important. And we see our team, and we also provides community with good message. That means not visit the patient in the hospital. Everywhere we need to hygiene in the surface and information to announce the people washing and keeps the distance, like distancing and all of this. Here is official announcement to not encourage the people to go to the hospital within the epidemic. And the next one is very important, the information technology application. COVID-19 to put the hospital become more faster to be digital hospital. We can see Vietnam have blue zone to make faster to tracing when the case detected. We apply electronic health declaration in the hospital. We also apply hit list spike, and we apply administrative system like a base for connecting all the department in hospital. We call the digital hospital. Provides online health service like Assoc.Care we already apply. And last one is applying artificial intelligence and ECHO. ECHO stands for the extension community healthcare outcome, remotely consultation. That is make it effectively. In summary, COVID-19 is still very severe pandemic in the world. Vietnam has very good response by rapid TTQ with the whole political system involvement, so that under control at the moment, but still need to be maintained in the new normal. In that Save a Hospital initiative is most important in new normal protecting community. 3-layer screening for COVID-19 model is effective. That all hospitals should follow to be safe. Rapid and accurate tests such as GeneSpurt for early detecting and new case is very useful for this model. And last one is the leadership play a critical role to make hospitals safe in the new normal. Thank you very much for your attention. We would like to thank our colleague from National Lung Hospital, Vietnam Lung Association, National TB Program, WHO, the country office in Vietnam, and 5F Group provides the dashboard with the Untitled Institute of Medical Research and our patient. Thank you. And welcome to this question and comment.
Thank you very much, Dr. Nhung, for a very nice talk and summary about the way that Vietnamese government has implanted to cope with COVID-19, and also introduction about the screening model in many layers in your hospital. To my understanding, lung disease is one of the risk factors for catching COVID-19 and as well as to receive the severe, and lung disease is the risk factor for severe COVID-19 infection. And that's why your hospital use a very aggressive screening strategy. I have a question about the cost effectiveness of this method. And do you think that is applicable to other hospitals in the community?
Yes, that is a very, very important question. The cost effective.
Yeah, because you show that you need to screen 11,000 patients to catch one case, right?
No, that is a figure of the country.
I see.
This is not in the hospital. It is the laboratory test accumulated in the country. We analyze it, not in the hospital. Hospitals, the majority in the screening by symptom, and we apply the GeneSpurt rapid test for this model. So this model, I think first, it is necessary for the own hospital. The second, the cost, it depends on how to arrange this model in the hospital. We already have support from Nguyen Fund and protecting the hospital, just modify some infrastructure. Like we need isolated clinic, very near to screening site. Screening, we can provide the remote temperature check. We apply the electronic declaration for health and connecting with his health information system. And that's it. And now we scan up with the GeneSpurt. That is very fast. It's the 30 or 45 minutes. And this is already support from the Nguyen Fund. So I think this model can be applied for any hospital, only just a modified infrastructure. But the most important is the leadership. The director need to take this like an initiative necessary for the safe hospital.
Thank you very much. Dr. Ang, do we have any other questions from the floor?
Dr. Wick, can I ask one question?
Yes, please.
Thank you, Professor Nhung, for very comprehensive and effective models. One thing I can see from your proposed model is majorities of the measures so far apply into the patient. But I wonder, do you consider any measures, preventive measure that apply to the medical staff? For example, like the antibody testing for medical staff to identify the people who got infected but without symptom. Thank you very much.
Oh, thank you very much, Dr. Dang. This one thing we are also thinking about. For example, we test antigen only the person who currently have disease, but the disease the past already. So rapid test like the serology for the surveillance, I think this should apply for the community. And the hospital, we also have some useful for this, for detecting who miss the period of the detection, for how to say, revert back to the time they got, and then identify who contact with them by that time, and might be identify the other resource of the infectious case. But for the safe hospital, I think at the moment we do not have this policy to test serology in the hospital.
Yeah, okay, thank you.
Thank you very much.
I have a question, Dr.
Yes,
Wee.
please.
Dr. Nhung, such a fabulous and detailed presentations. I learned so much from your presentation. I'm wondering, for vaccine, COVID-19 is coming, how you and Vietnam strategy to apply vaccine, and because the number of prevalence of COVID-19 is such a so low in Vietnam at the moment, and so can you share with us what is the next plan for vaccine COVID-19 in Vietnam?
Thank you. This is not, I'm not the position to answer adequately of this, but just my thinking. The vaccine, it takes time. In my point of view, I think in Vietnam to make the delivery step as soon as 2022, it's not 2021. And we can see the Sputnik vaccine in Russia, but not yet impact to the controlling epidemic. So for COVID-19, in my mind, the most important intervention, strong, timely, as soon as possible, as early and rapidly. That is important. So I want to emphasize the political commitment of the government and the whole system, political system, working with the core in the healthcare system. I think that is adequate. I not say that we have very low mortality, that the health system in Vietnam is a very high level. It's low. It's still not very high compared to America or other. But the workload, if the epidemic is the level is very high, the health system cannot handle. So we need to control COVID-19 in the early stage, like in the border. And if the country's border, like the air border or the in the land border, but for hospital, the border, that is the gate. So the screening at the beginning is very important for the safe hospital. That is the concept. Vaccine is of course, that is the like a long-term control. We look forward as soon as possible. But in Vietnam, I think the vaccine is not yet in the policy. And I have heard that in the Ministry of Health, we also discuss on the vaccine, how to do that. But also encourage our scientists and institutions to develop the vaccine. And for example, in Pfizer, we keep in the minus 80 degree, that delivery in Vietnam, I think is very, very difficult and might be not affordable as well. Thank you.